I've recently been promoted to the lead dentist role in my corporate job. This is an incredible milestone for me in my career. I couldn't be any more excited to tell you all about it. And this may happen to you very soon too, so be sure to stick till the end and give me some input on whether I should take this offer or not. As always, I'm here to create content for the next generation of dentists, where we talk about clinical tips and getting on that journey to becoming financially independent. It's all covered here, from the perks to the challenges, so if you enjoyed this video, please give it a thumbs up. All right, let's jump right into today's discussion. All right, so picture this. I'm sitting down at my all-time favorite food spot, Chili's, with my clinical director. As we chat one-on-one, little did I know that this lunch would be a life-changing moment for me. Out of the blue, he looks at me and says, "We're ready to give you a promotion, Dr. Rana." I couldn't believe my ears. My mind went wild with excitement. Moving up from being an associate to becoming a lead dentist? Let's go. The possibilities were endless and the perks that awaited me were incredible. With the promotion came more responsibility, but I was ready to take it head on. My whole outlook on life was about to transform. The thought of advancing within the company had me bubbling with anticipation. Since I really enjoyed my mouth-watering mushroom Swiss Big Mouth burger, I absolutely have to give a shout out to the oh-so-talented chef Nick. You see, Nick's just not any chef. He's actually my homie. When my team and I swing by, he always goes above and beyond to serve us an amazing meal. Actually, our dental practice shares a parking lot with Chili's. So when Nick came to my office suffering from that excruciating tooth pain, I soon discovered he was the mastermind behind all those amazing meals. Naturally, I took extra care in treating him, performing a surgical extraction with bone graft, and I assured him he was in capable hands. I told him he was well on his way to receiving an implant and gaining back that proper chewing function. You know, it's moments like these that remind me of the impact we as dentists can have on people's lives in our community. Now, back to lunch with my clinical director. He leans in and says, "Doc, your time has come. You're ready for that promotion. It's been 8 short months and you've shown incredible progress. It's time to take the next step." Can you honestly imagine the surge of excitement that was coursing through my veins? It was a defining moment in my career, filled with immense pride and gratitude. And from that point forward, my journey as an empowered leader would begin, and I couldn't be any more ready to embrace it. By the way, let me share a little something about my clinical director. This man is an absolute legend, a true GOAT. With his ownership of over 30 practices, he's like the Henry Cavill of the dental world, blending charm and skill effortlessly. Seriously, he's got the surgical finesse of Dr. Miami. He's an all-around incredible guy. You might think someone of his stature would be distant and unapproachable, but he's proven to be an exceptional mentor for me. And he's given me everything I could have ever wanted in terms of guidance and support, always looking out for my best interests. And over the past 12 to 15 years, he has meticulously built an infrastructure that ensures the success and prosperity of all the doctors in his network. Whenever I find myself stuck or in need of assistance, he's always just a quick text message away. And he's always been incredibly supportive. He even takes the time out of his busy schedule twice a month to personally teach me implant placement. Just imagine getting to learn from a skilled surgeon who has placed thousands of implants. It's an absolute dream to learn both business and surgery from him. And it's a really funny story how all this came to be. But I'm eternally grateful to have bumped into him while I was slightly drunk at a bar in Chicago, where within 4 quick minutes, he offered me the opportunity of a lifetime to fly down to Fort Myers and work at one of the busiest practices in the entire country. And I woke up the next morning thinking like, yo, did that really just happen or was that a dream? Turns out it was very real. And now to be given this incredible opportunity at a promotion, he says he sees something of himself in me, appreciating my passion for oral surgery and recognizing my drive. He says this motivated him to push me to the next level, knowing that together, we can expand his business. So there we were, sitting at Chili's having my weekly cheat meal. And he looks at me and says, "Doc, it's been 7 months. You're exceeding all expectations and progressing at an exceptional pace. It's time for the next step. I'm here to offer you a promotion. You're ready for it, right?" And you can only imagine the sheer excitement that coursed through my veins. I was absolutely ecstatic. So what does this promotion actually entail? Well, let me break it down for you. I'll be stepping into the role of a lead dentist in my very own practice, which is a super exciting thought. This practice is brand spanking new. And guess what? I'll have full control over every aspect of it. From assembling my dream team, handpicking the equipment I desire to use, all the power will be in my hand. I'll have the freedom to choose which procedures I want to perform and which I choose to refer out. You see, as an associate dentist, I currently don't have this level of control. At times, I'm restricted in ordering the supplies I truly need for the procedures I'd like to challenge myself with. And I also lack the authority to select my own staff, making hiring and firing decisions, which can sometimes be tough for the office culture. Furthermore, my office has current limitations on the procedures we offer. For instance, I'm not allowed to do endo and veneers due to their complexity and potential failure rate. But this lack of autonomy restricts my ability to explore new avenues in dentistry and grow as a clinician. However, in my new practice, I will have complete freedom to offer a wide variety of the procedures I want to offer. The possibilities for growth and learning are an excellent selling point in taking this promotion. And here's the icing on the cake. My salary will potentially increase by a large amount. Can you believe it? This is a milestone I've literally been waiting on my entire life. Of course, at the end of the day, a job is about making a living, but it's also about making a positive impact on people's lives. With this promotion, I'll not only have the opportunity to increase my income, also to have more input on how we can continue helping more people in the process. It's a win-win situation that has me so excited. But on the topic of pay, let me explain how my current job's pay structure looks. Currently, I receive a daily rate, as well as a bonus percentage based on the total office production. And as an associate, my bonus ranges from 8 to 10% of the total office production. However, as a lead dentist, the percentage skyrockets to a total of 16 to 20%. This is a significant jump considering that bonuses can quickly make up the bulk of our earnings in this company. It's definitely something to take into consideration. When I mention total office production, I'm referring to the combined earnings generated when OMFS, endo, and even hygienes contribute to the practice. I receive a portion of all of that production, which is killer. However, as a lead dentist, there are specific production targets that I must meet in order to qualify for these bonuses. Like any job, reaching these goals is essential into receiving an appropriate compensation. There may be instances where if we fall short of the target, I could potentially receive 0 bonus for the month. So this prospect of the offer has me a little bit nerve-wracked for the moment, and it's making me contemplate whether or not to accept this promotion. Furthermore, there are instances where factors beyond my control influence the outcome of a case or certain production numbers. It could be due to issues like the front desk failing to verify patients' insurance, or the office manager being unable to secure patients' acceptance or financing after a lengthy discussion with me in the new patient exam. There's a ton of variables that are coming into play, and it could be a genuine source of concern. With a brand new team and a new location, a significant portion of the outcome depends on me, but not everything. And this aspect worries me in terms of my future pay structure. Nevertheless, there is potential for substantial earnings, reaching as high as $400,000 per year as a clinical director of a practice after only a few years of hard work. Guys, I'm curious to know where you are on your journey and how you feel with your own job trajectory. Do you feel like you're close to a promotion? Do you want the added responsibility? Or are you looking to leave your current job altogether for a better opportunity? Be sure to keep the discussion going in the comments below. Now, the offer itself sounds fantastic, but there's more. I also have the exciting opportunity to potentially buy into the practice one day. And I'm sure it's a dream shared by many people who are watching this video today. Owning a practice has always been a dream of mine, and my clinical director is providing me a pathway to achieve it. He explained that if I consistently perform well, lead a successful team, and train other doctors under my guidance, I too would have the opportunity to buy into the practice and become a part owner. This opportunity opens up the potential for expanding my influence across multiple practices. All good stuff, making this opportunity too good to pass up on, right? Well, not so fast there. Let's talk about some of the downsides of this offer that I carefully need to consider. The most significant drawback of this offer is that I need to relocate again. Already made a major move of moving 1,200 miles away from New York City to Florida. Now I'm faced with the idea of moving again to an even smaller, quieter beach town, which caters to an even older demographic. Just to put things in perspective, where I currently live now, they call it heaven's waiting room. I can only imagine happy hours at the new neighborhood bar where I'm stuck in a heated debate with my new friends on whose dentures have the best suction. The idea of uprooting myself completely, starting over in a new place, and having to build a fresh support system and social circle feels incredibly stressful. And just when I thought I was settling down in Fort Myers, I'm asked to pack my bags and relocate again. To add to the challenge, my clinical director advised me against living in the town itself, as he says it's not the safest and most lively. So instead, he recommends that I live 35 to 40 minutes away and make the commute every day. This means that my current 1.5 minute commute to work, where I can practically run to the office, will transform into a possibly 50-minute commute with traffic. That equates to an 1.5 to 2 hours of commuting each day. Personally, I've always believed that living more than 20 to 25 minutes away from work starts to become burdensome and can really take a toll on one's overall quality of life. So I think it's crucial to consider this aspect when choosing your first job or any subsequent opportunity. If the commute to your workplace is lengthy, it can drain your energy levels and impact your happiness. So keep that factor in mind when you decide to make your decisions for your own professional journey. Being a lead doctor certainly comes with its own share of challenges and downsides too. One of the drawbacks is having less vacation time available. When you have an associate dentist, they can step in to cover for you when you need time off. Furthermore, being a solo dentist in a practice is really freaking stressful. Seriously. I always approach a challenge with the utmost confidence in my abilities. I can't lie to you guys, I've been knocked on my butt a couple times while covering for dentists as well. So I've experienced the intensity and pressure that comes with shouldering the responsibilities alone. The workload can start to accumulate rapidly, leaving you feeling frustrated and overwhelmed. And this can have a significant impact on your overall mood and satisfaction with your work. I've witnessed firsthand what it's like to be the only doctor in a busy practice. And if you're not adequately prepared, it can be an overwhelming experience, trust me. Some days you're gonna wanna find yourself double fisting 2 Red Bulls to start the day, because it feels like you need that level of energy just to keep up. Then the sticky notes of more patients being seated start to pile up on the door. All this happening while you're currently stuck in a procedure that you didn't expect to take that long. If you know this feeling, it can be very stressful. And it's not to say I can't handle the challenges or that it's unexpected in a high volume office, but it's undeniably a lot to handle, especially for someone who's just starting their career. I do feel confident in my ability to step up to the challenge, but the question is whether this particular situation is the right fit for me. As the leader, everything falls on your shoulders, and when someone on the team isn't performing their duties effectively, it becomes your problem to solve it. I've heard horror stories from friends about the consequences of unskilled dental assistants or an office manager who struggles to close cases due to the lack of experience. As a solo practitioner, you take on the added responsibility of handling these issues. And in this present moment, my office runs smoothly with a well-trained and efficient team in place. I rarely experience that high level of stress that can come from not having a competent staff or a proficient front desk. The current setup I'm in allows me to focus on providing quality care without excessive burden or complications, and I genuinely appreciate the smooth operations of my office now. Lastly, there's a possibility that I may end up making less money if I accept the promotion. It's definitely got higher upside, but it's still a risk at the end of the day. And it can be quite surprising to hear that, considering I'm currently working in the top office in the country as an associate. But transitioning to my own new office would present challenges, and I might struggle to adapt. We might even have to start accepting lower paying insurances and Medicaid, which adds a whole other level of complexity with hitting our monthly targets. There are numerous other factors beyond my control that could hinder the success of the office as I try to take it to the next level. And to sum all of this up, my plate is already full of responsibilities, and I have really mixed feelings about the direction I'm heading in. I'm unsure if I'm truly prepared for the increased workload of managing a team and dealing with all the non-clinical aspects of dentistry. It's only been a few short months since I've graduated dental school, and I'm already experiencing anxiety and fear at the thought of uprooting my life once again and starting a new chapter with unfamiliar faces. Guys, this is not an easy decision for me to make. I had to leave everything behind in New York and build a brand new life here without knowing a single person in the state. Facing the idea of having to do it all over again seems overwhelming in this moment. And I'm just unsure about the path I should take because as it stands, I love my current team. We have great rapport and we're doing a great job. And going to work is enjoyable. I'm content with my job and the well-established team has everything functioning smoothly and has been for years. In this office now, I can focus on just the dentistry, earn a good income, and provide the best care possible for the patients of Fort Myers, which is truly rewarding. Moreover, I have a great work-life balance. I don't have any complaints about my current job. It's just a 10-minute drive from the airport, allowing me flexibility to fly back to New Jersey and New York whenever I want. And that flight's only 2.5 hours away, which is quite manageable. This new office location is in the middle of the state where it's 2 hours away from an airport. And as you can probably tell, I don't know what to do right now. On one hand, there's the allure of a promotion and the potential for growth and ownership in the future. But on the other hand, there's uncertainties and added responsibilities and the prospect of making less money. Right now, I appreciate the harmony within my existing team and the fulfilling work we do. These factors make the decision process challenging and leave me uncertain about which path I should choose. So I currently haven't made a decision yet, but I value your input. What do you think I should do? Drop a comment down below. If you're a dentist or a dental student watching this video, please support my channel by hitting that like button. As always guys, take care, stay blessed, and may success follow you on every step of your journey. Dr. Rana here signing off.